The nail is one of the few structures on the body that people routinely file, scrape, cut, drill, soak, and chemically coat without ever having learned its anatomy. One of the strangest things about the nail industry is how many incorrect terms have become normal. People call living skin cuticle, they call normal anatomy pterygium, and they remove a ton of tissue that honestly should not even be touched. So today, I want to reset that. Hi guys, Liz here. In this episode, we're going to walk through nail anatomy in a very clear technical way so that you actually understand what you're working on. I'll be using visuals to point out each area of the nail, what it's called, and what it does. Because moving forward in this series, I want to be able to say things like proximal nail fold or hyponychium or free edge and have you immediately know what I'm referring to. And just as importantly, we're going to clear up some really common misinformation that commonly leads to damage. So before we start labeling everything, I want you thinking about the nail in a very simple structural way. You have a growth center, a plate that moves forward, and surrounding tissue that protects that system. And when we're doing any type of artificial nail product, especially gel nails, we are primarily working on the nail plate. But everything around it matters because that's what keeps the system healthy. So let's start here. This is the nail plate. This is the hard surface that you see and work on. It's made of keratin and it is not living tissue, which means it does not breathe, it does not feel, and it cannot heal itself. What it can do is grow out, and that growth comes from deeper within the nail. The nail plate is formed in the matrix. That's the area underneath the skin at the base of the nail. You don't see most of it, but it's where the nail is created. Now, what you can sometimes see is this area here. This is the lunula, that pale half moon shape. And what that actually is partially formed nail plate. So it's not a different structure. It's just a nail that hasn't fully compacted and hardened yet. And that's why it looks lighter. You might not see a lunula on every single finger, but usually you'll have one or two that are visible. Underneath the nail plate is the nail bed. This is living tissue. This is where your blood supply is. This is why your nails look pink or maybe sometimes red or purple. And this is where sensitivity comes from because we have nerve endings in our nail beds. So when someone says their nail hurts, they're not talking about the nail plate itself. They're talking about the nail bed underneath it or sometimes the surrounding tissues. If this video is already helping you, be sure to like and subscribe because this video is part of a larger series called How to Do Gel Nails at Home. You can start from the beginning at any time, and I recommend watching this series in order if you want the full foundation. And throughout the series, I'll occasionally drop some small knowledge check-ins and rewards for those of you that are truly paying attention. So keep watching. Now let's move forward. This part here is the free edge, also called the distal edge. This is where the nail plate extends past the fingertip. There's no nail bed underneath this portion anymore, and this is where you'll often see peeling or delamination if the nail is damaged. This is also the part that often comes into contact with surfaces, is constantly chipping or cracking or breaking, and it's also the part that we clip off and file when we want to remove length. On the sides of the nail, you have the sidewalls, also called the lateral nail folds. These are living tissue, living skin structures. They help guide and protect the nail as it grows, so when you're filing or applying product, these are areas you want to respect, not dig into or overwork. We want to think of the lateral nail folds as the guardrails for our nail plate, and they serve a very important function. Now, this is one of the most important distinctions in nail anatomy. This area here is the proximal nail fold, or the PNF. This is living skin. It is not cuticle, and I know it's often referred to as cuticle. Sometimes this area can appear stretched or lifted, or sometimes it can be torn, and people often think that is cuticle that needs to be removed, but it's not. It's living tissue. And aggressively cutting or removing the proximal nail fold can lead to things like irritation, inflammation, maybe even long-term issues with nail growth if we ultimately end up damaging the matrix area. And it's also where we can get infections underneath our skin. So this is an area where precision and understanding really matter. Actual cuticle is something very, very different. Cuticle is the thin, dead tissue that adheres to the nail plate itself. It's often dry, semi-translucent, or white-looking, and stuck directly to the surface of the nail plate. That is what we remove during prep, not the living skin around the nail. So when you hear remove the cuticle, this is what we're talking about. We're not talking about cutting skin. Now let's clear up another term that gets misused a lot, or at least it used to. Pterygium is not the proximal nail fold. It is not the same thing. Pterygium is actually an abnormal condition. It's when living skin starts to grow forward and attach to the nail plate, often splitting the nail plate in half. That's not something you should be aggressively removing. It's something that needs to be handled extremely carefully. So using that term casually for normal anatomy is incorrect. Under the free edge at the tip of our finger, we have something called the hyponychium. This is living tissue, and it acts like a seal. It helps prevent debris and bacteria from getting up underneath our nails. So if you've ever hit or injured that area or had a fingernail or toenail get ripped off, or maybe you've over trimmed a nail, you know that area is sensitive because we have nerve endings in our nail beds. And it's also why overfiling underneath the nail can cause problems. It's also important to know that the hyponychium will often extend the longer we wear our nails. So if you've ever gone from really long nails to short nails and you see that hyponychium sticking out, don't be tempted to trim it. It'll usually recede on its own once it's no longer trying to support longer lengths. Now let's come back to the nail plate for a second. The nail plate is made up of layers of keratin. These layers are formed in the matrix and then pushed forward over time. So when you file aggressively or remove product improperly, you're not just affecting the surface of the nail, you're removing layers of the nail plate itself, and that's what leads to thinning, peeling, and long-term damage. And sometimes the damage is so severe that we have no other recourse but to wait until the nail plate completely grows out. So the goal of this episode is simple. I want you to understand what you're actually working on, not just where things are, but what they are and the proper terminology for them. Once you have clarity around nail anatomy, everything else when we get into nail preparation and application is going to be so much easier, so much more precise, and a lot safer. And moving forward, I'll be using these terms consistently so we can continue to build on this foundation. I'll see you guys in the next episode.